Welcome to what is our second Jewish Family and Career Services Community Chat of 2024. My name is David Fink. I am the CEO of Jewish Family and Career Services, and I appreciate you all being here. Before we start the evening, I would like to thank Cantor Lip from Congregation Adath Jeshurun for helping sponsor tonight, along with the Cari Kleinman for the Children Fund for sponsoring this forum. We appreciate you and your collaboration and making sure that the community has this opportunity to learn about tonight's topic as well as other topics that are so important to our community. As Cantor Lip came in, he commented about how full the room was. And it is indeed full, which reminds us all of how our hearts are heavy from this weekend's events. Of course, this forum was planned many months in the past, but I think it's a reminder of the trauma that our entire community experiences, and that when we lose any life, we all lose a little bit of a life, and that's actually a poorly restated Jewish parable, right? That, when one of us dies, there's a little bit of all of us that dies. And I think that that's an important message that we're gonna continue to talk about a little bit tonight, as we all share in the importance of understanding community violence and doing what we can to prevent community violence. It's through that we begin to worry about ourselves. So we think about violence in our community. We worry about our families, our coworkers, the children we have, and the children that we care about. And so tonight's is an event where we're gonna talk about violence in our community. We're gonna define what we mean by violence. While that sounds like a simple term, violence means something different depending upon perspective. And I think we need to talk about that a bit. And we'll discuss some prevention and intervention programs, many of which have been very effective, obviously not effective enough, and some of the resources that are available to our community members. We're also gonna have everyone here tonight. It's our hope that we will all realize that we all play a part in the solution to violence. And really, I would say that our negligence of it is part of the problem. And so I would even add that piece. Now, before we do all that, to start the evening off, I'd like to introduce Deputy Mayor David James. As many of you know, Deputy James has had a distinguished career of service as a police officer in our community, president of Metro Council, and now is Deputy Mayor at Metro Government. Deputy James, please join us and welcome. Thank you.
Well, good evening, everyone. I'm glad to be here, and the mayor is unhappy that he's unable to be here, so you're kind of stuck with me today. A few things I just want to talk about as it relates to violence and the subject matter that we're talking about. We've just experienced a horrific weekend. A lot of people were hurt this weekend, many of them under the age of 18. And it's frustrating and it's aggravating. It feels like it just takes a part out of your soul away to experience it. And so I just want to talk a little bit today about community violence and the problem that it actually is, because it's an extremely complicated topic. Community violence not only has physical effects on individuals, but it also affects and reverberates throughout our entire community, through all of our souls, through our neighborhoods, through our homes, and through our families. Because when you think about one person being shot, it's not just that one person. It's their family, it's their brothers, their sisters, their mothers, their fathers, their friends at school. And it has a dramatic impact. And being exposed to and experiencing violence through our community has an effect on the well-being of our children. Just think about this. When you're a child, especially if you live in a neighborhood where you see violence on a regular basis, where it's not unusual to hear gunshots, where you may have to sleep on the floor or in a bathtub so you don't get shot by stray bullets. If you don't think that that has an effect on you, then it does. And it's a very dramatic effect. And while gun violence in Louisville has decreased substantially than it was 2 years ago, it's down 35%. But that's not anything compared to the number that it actually is, right? I can remember back in 2011 or so, our gun violence deaths were somewhere in the neighborhood of 41 deaths, right? And now we're last year at 175. That's a lot. So when we say we're down 35%, you say 35% from what? But the best part about it is it's preventable. But that's the worst part about it, because the only way that it's preventable is if we all think that it's preventable and we all work together recognizing that it's preventable. And we often say, well, the police can take care of that. They can't. The police will be the first ones to tell you they are not the solution to this problem. They are part of the solution to this problem. We are the solution to this problem. And we have to work together and understand that we're a solution to this problem. And if we don't do that, we will fail. And we can't say to ourselves, well, that happened over there in that neighborhood. It's not my problem, because it is your problem. Always say that things aren't a problem till it is a problem, right? And so one of the things that the mayor is often talking to us about is that our gun violence problem has to be something that has to be solved by the entirety of the community and the entirety of government. Government can't operate in the silos that it's operated in the past if we expect to solve these complicated issues. The community can't operate in the silos that it operates in if we expect to solve these problems. We can't say, well, it's a black person problem, it's a white person problem, oh, it's a Jewish problem, oh, it's the Baptist. No, that's not it. It's our problem. It's Louisville's problem. And unless we address it as Louisville's problem, it's going to be a problem that we will not solve. And so I know that I've rambled on a little bit, but I just really want to emphasize the point that we have to work together to do this, and if we don't, we will not succeed. And every day, I get a text message every time somebody gets shot in our community, and it hurts my soul. And so I'm glad that you're putting on this event today, and I'm glad that we're going to have hard conversations today. Thank you very much.
Well, thank you, Deputy Mayor James, although, as you all will hear, he stole my entire speech. So, but being the ever narcissist that I am, I'm gonna say my speech anyway, and I hope you all enjoy it. No, I really do appreciate you taking the time to attend today and kick us off in such an important and meaningful way. And I would like to thank other members of Metro Council and employees that serve our community as part of Metro government, and our state officials and a retired judge who's here. And I would like all of you to stand for a moment. Those who work for city government, those who are elected officials, those who have worked in city government. Mayor James, Deputy Mayor James, you have to stand as well. So, thank you. Thank you. Now, before we start the discussion, I do want to take a moment, and some of you may be new to Jewish Family and Career Services, and so I always, as a CEO, I need to take my few moments of free advertising time. JFCS has been in this community for 116 years, and we have served this community, the entire community, for 116 years. We have grown with this community and pivoted to meet its needs on a regular basis. We have mental health services, we have a career and economic opportunity program, we have older adult services, and we have an intensive case management that includes a food pantry, which in this day and age of Islamophobia and anti-Semitism, I often add that it is a food pantry that carries both halal food for members of the Islamic faith and kosher food for members of the Jewish faith that keep kosher. So I think that's an important piece to mention. Each year we serve nearly 2,000 individuals and families, roughly. And these are actually the statistics. Roughly a quarter of the folks we serve are Jewish. Roughly a quarter of those folks identify themselves as Black or African American. Roughly a quarter identify themselves as Latinx or Hispanic. And roughly a quarter identify as refugee or immigrant, from the refugee and immigrant population. So when I say we serve the community, we serve the community. As we continue to grow, and we plan to continue to grow, to serve both the Jewish community and the larger Louisville community. And part of the reason we have been able to have such an impact and growth over the last 3 years is that we've leaned into some very important truths that we have found here at JFCS. One is that you have to listen to your community, which is part of what the community chats do. And as you serve, you have to let the families guide you and the families tell you what they need. You have to look at the systems that impact those families and continue to limit their opportunities to make free choices. And you have to work with other community stakeholders, nonprofits, government entities, and others, as we all work towards a common solution, because that's the only way to solve the hardest solutions we have. So we serve the community holistically. We believe in collaboration over competition, which is why we have these community chats. I am going to take a few moments to give you some examples of some programs that one we've had for a bit and one we are starting that feed into this and are relevant to tonight. One of those is the attendance improvement model known as AIM. AIM's AIM, and yes, that was on purpose. AIM's AIM, which is a collaboration with Jefferson County Public Schools, the Administrative Office of the Courts, Jefferson Family Court Judges, Metro Parks, Sowing Seeds of Faith, Martin and Muir Counseling, and we will have other nonprofits joining us shortly, is to return to a truancy prevention project that occurred here in the 90s and had become a model nationwide that Louisville had abandoned. And we are going to return to that and do it even better, where we will identify families that are at risk for truancy in the next academic year and provide services for those families that they need the way they need them, so that those kids and those families never have to come into the juvenile justice system. And I will add that when I say pilot schools, we have an elementary school, a middle school, and a high school. So we have the breadth of the JCPS educational system in this pilot program. We also have a program called Launch, which honestly, in the interest of full disclosure, is partially funded by the Office of Safe and Healthy Neighborhoods. Thank you, Paul. And also relies on collaboration with Friskies, with the court-designated workers, that receives referrals for justice-involved youth and young adults to help them look at career and economic opportunities for them. It can help them, guide them towards our Navigate program that does business advising and micro-lending for folks with entrepreneurial ideas. But Launch also partners with other nonprofits in the community, especially residential programs, who serve some of our most at-risk youth, to provide some of those adulting services that our kids so desperately need. Now, why we're here. I'm going to introduce you to the panelists in a moment, but here we go, echoing Deputy Mayor James's words. You'll notice that the panelists, none of them are Metro government employees, and none of them are police officers. This was a decision that we made with intentionality. I'm not immune to this notion that police have to police and that Metro government has to serve the community. However, again, to echo your comments, most of our social problems, and community violence is one of those, are not a program that we can police ourselves out of or legislate ourselves out of. It takes a community effort. So tonight's conversation is really focused on what community can do to reduce violence, and to acknowledge some of the causes of that. And before we do that, I do want to recognize, I've already referenced the Office of Safe and Healthy Neighborhoods, but I want to make sure that everybody's aware in this room that OCEAN is a program within Metro government that has a direct line of service, but also funds many of the programs that we're going to be referencing tonight and are going to be commented on tonight, that does a lot of important work in intervention, both in violence interruption, so talking people into turning over their guns or putting their guns away rather than retaliating in that moment. Also at the next level up about some of the services that are involved, including the Launch program that I referenced earlier. Some of those programs include the Trauma Resilient Community, of which at one time I was a member, Reimagine Network, Neighborhood Anti-Violence Coalitions, One Love Louisville's action plans. There's other violence interrupters that I believe OCEAN helps with, such as No More Red Dots that many people are aware of in every town. And there's going to be other programs that we will mention as the night progresses. But now let me introduce our panelists, who are important for you to know. Immediately to my right is Ms. Kathryn Ryan Cowart, who's a licensed professional counselor. Ms. Cowart is the Assistant Director of Programs at Jewish Family and Career Services. She has been a community professional for 13 years with experience in clinical counseling and administrative management. Kathryn came to JFCS from 7 County Services, where she served as a clinical and program supervisor. Originally from Northern Kentucky, Kathryn graduated from Loyola University Chicago and the University of Louisville, where she earned her master's in clinical counseling with a concentration in art therapy. In addition to her work at 7 County Services, Kathryn worked at Bellwood and Brooklawn, formerly Euspiritus, as both clinical counselor and later clinical director. Kathryn's clinical background includes work with children through adults in a variety of mental health concerns, but especially, and I know this from many years of work together, she's a keen provider of services for individuals with significant trauma histories. At Jewish Family and Career Services, Kathryn oversees youth-related programming, our clinical services program, our family stability program, which includes the food pantry and case management services, and has helped foster the growth of our clinical program by about 120% over the last 2 years. Ms. Cowart, thank you and welcome. All right. I know her well enough. Don't clap that much. For this next individual, we should clap a lot. Next is Mr. Trent Findley. Mr. Findley is the Director of Equitable Community for Metro United Way. Trent is a dedicated advocate for fostering inclusive environments and advancing equitable social and economic change. With a passion for driving positive change, Trent brings a wealth of experience in creating and implementing equitable strategies. Trent has served Metro United Way for nearly 5 years after previously working in financial services for more than a decade. Trent is a native of Louisville, Kentucky, and graduated from the University of Tennessee. He's also earned a certificate in diversity and inclusion from Cornell University and is a certified diversity professional through the Institute of Diversity Certification. Beyond the professional realm, which is always important, Trent is deeply committed to the middle school, to community, especially the youth, serving as the head chess coach for Newburgh Middle School and is the founder of Newburgh Legacy Chess Club, a U.S. chess affiliated youth club. Trent resides in Louisville with his wife, Ashley, and their children, Trent Jr., Ashton, and Gianna. Welcome, Trent. Thank you. So I'm particularly excited by our next guest because I have been a moderator for another panel in which he was a presenter at the Juvenile Justice Mental Health Summit about a year ago. And I know Dequantay, as he goes by, has a lot of important and meaningful things to say for us. Next is Dequantay Smith, who was born and raised in Louisville, Kentucky. He was a student athlete in high school and loved playing basketball most. Mr. Smith graduated from Youth Build Louisville in 2023, and it was during his time there that he became involved with Reform Louisville. Reform Louisville focuses on improving opportunities for youth in Louisville and making the justice system work better for youth and adults. As a member of Reform Louisville, Mr. Smith helped secure changes in law during the 2023 legislation. And I will pause a moment and say that if you ever want to ask Whitney Westerfield about sitting down with Dequantay, he will tell you about sitting down with Dequantay. He had quite an impression on Senator Westerfield. This legislation strengthened the ability for nonprofit organizations to work with youth who are incarcerated and to support their transition home. In addition to a full-time job, Mr. Smith has shared his experience and insight on a number of panels in the interest of improving opportunities for other youth who become involved in the juvenile justice system. Dequantay, welcome, and I appreciate you being here. Last but not least is Derek Selznick, Director of Development at Whitney Strong. Derek has nearly 20 years of experience working with 501 or nonprofits in various roles. Derek's professional journey led him to specialize in advocacy on the local, state, and federal level, leading to fundraising campaigns, developing long-term strategic visions for organizations, and leading programs, organizations from the startup phase to long-term stability. He has had the privilege of serving as a member of the Kentucky Commission on Women's Mental Health Policy Council, lectured at multiple universities, law programs, and medical schools, and lobbied in both Frankfurt and Washington, D.C. Professionally, Derek's greatest joy comes from turning so-called drab public policy into praxis that improves the lives it impacts and translating the important work for nonprofits that nonprofits do into fundraising. As a side note, I'm a little disappointed, Derek, that your favorite professional experience isn't being on Bingham Fellows with me, but we'll save that argument for another day. In Derek's free time, he loves being a husband, a dad, cooking, rock climbing, and learning from other people's stories. Derek, thank you for being here and welcome. So for those of you who have been to prior community chats, we've changed some things a little bit, and I forgot to mention one thing to all of you, which is that today's event is being videotaped. One of the things that we do with community chats is that after the event, usually 3 or 4 days, we post it onto our YouTube channel so that people who are not here can watch it. So at the end of tonight, or towards the end, with 15 or 20 minutes to go, we'll open up questions to the community here. So if you want to ask a question but don't want to be seen on camera, keep your back to the back of the room and keep facing this way. That's my recommendation. If you want to have a question asked, but you're on the shy side and don't want to stand up in front of, 70 people you don't know and ask a question, the new thing that we're doing is that there is a QR code at your seats, and you can use that QR code to post your question. My cell phone isn't working, so Courtney will hand me those questions, and I'll figure out a way to integrate them into our conversations. So there's, so that's for later. And you can do that if a question comes to you as the evening is going, you can post that, and I might be able to ask it in real time. So one of the first things I usually like to do in our community chats is sort of a level setting or definitions portion. So we're going to start with that. And the first question I'm going to start off with is with Kathryn. And again, for the panelists and for the audience, one of the things I hope will happen tonight is that I'll ask one person a question perhaps, and we'll get multiple answers from panelists. There's no question that's only going to be answered by one panelist. So I think we trust that they're not going to interrupt each other too much, and hopefully I'll just fade to the background as we go. So Kathryn, let's start with you. Tell us a little bit about what we consider violence, and we've talked about the community shootings this weekend, but we haven't talked about suicide. And is suicide considered part of violence? And can you kind of put all that together for us?
Of course. So from a therapeutic standpoint, I think kind of where I'm coming from, violence is harm against yourself or against other people, right? So we have lots of violence in our community. Some of it is intrapersonal, meaning, suicide and gun violence towards yourself. Some of it is interpersonal, right? In our communities, towards each other, towards our children, towards our parents, towards our elderly. And it's not all just gun violence, right? We see violence across the board, both emotionally, physically, mentally. So it spans a pretty broad range of what we're talking about. And obviously tonight, especially based on last weekend, we're looking at a narrower focus, I would imagine, as this conversation unfolds about physical violence towards self and towards others, but violence can be so much more expansive and so damaging to our community at large.
Thank you. Anybody have anything they want to add to that or thoughts about that?
Yeah, the one of the things that I would definitely say is absolutely agree that suicide is a form of violence. It's kind of one of the large pieces of our educational programming is work on suicide, but it also bleeds over into a lot of other places, especially in intimate partner violence, domestic violence. What we do know is school shooters, it tends to be actually an act of suicide that goes along with that violence. The same is for almost all mass shooters. This is actually an act of suicide. To say nothing of, kind of death by cop or any of those other things. So while, yes, we talk about it in relation to self-harm, usually, unfortunately, there is oftentimes a lot of external violence that goes on along with it.
Thank you. So Trent, I'm going to come to you next in your work with diversity and equity, as well as sort of Metro United Way's, I would say, positive footprint in our community as we think about that. And again, this gets back to some of what Deputy Mayor James had commented on. In Louisville, because of our history, I think, in this community, it's easy to designate a problem of violence as a neighborhood problem. Talk to me from your perspective about, or Metro United Way's perspective, either or both, about how that is not the right reflection of it, how that's not correct, and why it's a larger problem, a larger community problem.
First of all, it's an honor to be here and to be involved in such a critical conversation. I think that to the question of whether it's a community problem versus a neighborhood problem, it's both. People in neighborhoods are affected, but there are social, economic, and cultural, there's an intersection of social, economic, and cultural effects in a neighborhood that in the context of a metropolitan area, it's a community problem. So if we don't all know that, I want us to know that. At Metro United Way, now more than ever, we have 3 priority focus areas. That's thriving kids, strong households, and equitable community. And it's about addressing systemic issues while also creating paths out of poverty to prosperity, and ensuring that zip code does not dictate destiny. So we're definitely focused on this problem, and in those 3 focus areas, they're profoundly affected by community violence. And so also in those focus areas are some of the multifaceted solutions that are needed.
I would like to add to that. It's not just a neighborhood problem, it's a community problem, and here's why. The community provides resources that has been taken, such as, like, for example, community centers. Community centers is a big part because those kids in that neighborhood go to that community centers for tutoring, for school. They go to that community center for recreational time. And that also reduces the balance between the younger ones growing up because their mind is busy. They have something to do that's productive to them. And also their families. Their mother don't have to worry about them going outside, getting into any trouble, or possibly getting hurt or losing their life.
Thank you, Quante. So that's going to jump right into really the next question, which is, you talked about intersectionality, Trent, and marginalized communities, right? Quante, you talked about sort of losing community centers. So how do we address those inequities that have occurred, and how do we keep the violence from continuing to be perpetuated? What are some of the thoughts about how we can prevent those things from occurring?
My honest thoughts on that would be to prevent it, well, to prevent all of the violence within the youth, period, that they have to be one, which is motivated. 2, they have to see it. 3, the elders in the community, they need guidance from them, and also they need love from them, because the lack of love in these communities, it also plays a part too. When the youngest feel like there's nothing else, or they have nowhere to go, nothing to do, nobody to care for them, they don't see a brighter future, it causes a lot of trouble.
Thank you. I have a follow-up, but I wanted to look like, do you look like you were going to say something, Derek?
Oh, I'm okay right now.
Okay. So I'm gonna, I think this is related, but I'm gonna move in a slightly different direction and then come back to this piece, which is that, one theory about violence, and again, Mayor James talked about different theories about how violence occurs. One theory about violence, and I'll reference people to the James Gilligan book on why people killed, why they kill. It's the title of the book. There's an ability or a condition in which we begin to undervalue the person that we're facing, and that we see them as less than. And I also see this as sort of a central core, again, to something that Deputy Mayor James referenced when he referenced racism, anti-Semitism, Islamophobia, any xenophobia, et cetera. Is that, I'm kind of curious from you all as a group, is that something that also adds to this notion that violence within the community is a violence to all of us? Or is it something that affects just that community? My question would be, is there a contagion effect within the community that occurs when violence occurs and we aren't sensitive to it and we ignore it?
Okay, I have something to say on what you said. You feel like violence occurs when an individual feels or look at somebody else as less than them. With the problem that's going on in the community, I would disagree with that, because I'm not a killer, nobody is, or nothing like that, but I'm just saying, like, growing up in poverty or coming from the area that I grew up in, which is one of those communities that we're talking about, those people, okay, violence and victims. People is being victimized because the person that's committing that crime, or however y'all want to put it, is probably going through something financially, probably getting abused mentally, physically. All of these things goes on in home. And when you're young, 12, younger, 16, older, and you go outside and you don't know how to handle it, or you don't got nobody to talk to, then the person that you're looking at is who you take it out on. Not necessarily saying that you looking at them as less than I'm looking at you as less than me. That's not even the issue. I'm not even looking at you.
Appreciate that. So earlier I mentioned the AIM program that JFCS is gonna implement with other partners in the fall. There's another program in our community called the Education Engagement Hub, which is currently an opportunity for youth that are suspended from school or out of school for a variety of reasons to go somewhere, and this somewhere happens to be neighborhood house, to engage with adults and peers and learn instead of learning on e-school, which doesn't really work, doesn't happen much. There's not much learning on e-school. So in my mind, that's an example of kind of interventions along a continuum. And I think it falls into the idea that today's prevention is tomorrow's intervention. What other things is our community doing that you're aware of, or should our community be doing to support kids earlier so that they don't get into trouble?
I think the community is doing good with the exposure with the sports. A lot of kids is getting their athletic footage, and a lot of kids is getting recognized more when it comes to academic programs that's going on. And I think that that's good, because if the next child idols the child that's either doing good academically or doing good athletically, then that, it solves balance too. It also keeps a child motivated to do something positive, to do something constructive with themselves instead of being destructive to themselves and the community. Because it's hard. It's hard being positive when you're surrounded by negativity, and it's hard to want better when you've been influenced by worse.
It speaks to me of equity and accessibility, right? So exposure, if you can focus on a kid's strengths, right? And we're also looking at, which is kind of a different issue. We're looking at multi-generational systemic trauma, which is what you're touching on, right? So when you're not exposed to anything else and you don't feel like you have an out, what do? You do what you've always done. You do what you watched your parents do, your grandparents do, your brothers, your sisters, your cousins. So if you can fix a bike and we can elevate that child for doing that and expose other children to that skill set, or an artist instead of squashing that, right? Then we have this ability to show other kids you can do this too. And you can come into these community centers when and where they exist. And we all wish there were more of them, certainly, and build those skills and be rewarded for that and see a path out. Yeah.
I just want to, I'll add, so in terms of how we go about preventing violence, and you were asking about kids and promoting equity, I think that if you are in a place where you want to prevent violence, but you are not willing to, or you don't think that there should be a focus on equity, you're delusional. So I just want to add that. I mean,
back up. You got to do more than that for me. Because I've been, all the staff at JFCS tell me every day how delusional I am, and they're probably right. But what you mean by that is something different. So what is it about? So delusional, why? Like, I mean, you assume that everybody understands it, but play it out. Let it go.
well, violence, community violence is a multifaceted problem. It takes a multifaceted solution. So when violence happens, and kind of like Deputy Mayor James was saying, police officers do not prevent violence from happening. They simply are reacting, I should say. And so if you want to prevent violence, you want to prevent what causes the violence and kind of take steps back in the process. So then you should definitely want to prevent poverty. And there's, other things that I could name, but it definitely starts with lack of access to opportunities. I don't think any of us in this room would blame an elementary school child for acting up or falling asleep because they're hungry. So if we all understand that concept, then we should be trying to prevent that. Because believe it or not, there are a bunch of small problems like that, usually all of them related to equity, that bubble up and cause the violence that we see that starts in the youth. And then it goes on. And, there are other focuses as well, like mental health, that it certainly plays a role in violence in adults. So just if you're wanting to prevent violence, but you don't want to promote equity, you got to change it to where you're thinking.
Okay, thank you. You look like you were interested, Derek. Go.
Yeah, no, I just want to echo that, because I think what we're talking about is, what do youth have access to and what do they have opportunity for, right? And that can be very positive or it can be really negative, right? Do they have access to food? Do they have access to education? Do they have access to healthy exercise? Where is that access? Or is it, I have easy access to firearms? I have easy access to feeding for my family, not from working a regular after-school job, but doing more illicit activities. Where is the opportunity and where's the access? And I think, from our perspective at Whitney Strong, I can only speak for us, we don't believe, and I hate using this, but it is the most accurate way to describe it, there is no silver bullet for this issue, right? A lot of people would love to tell you it is one particular educational program, it is one particular policy, it is one particular organization. We don't believe that. We believe personally it is, for us, our role is working on the larger structural policy issues when it comes directly to firearms. And we believe, for us personally, our role is then to do education around safe storage and handling, suicide prevention, and how to intervene in case of a traumatic event such as a shooting or a stabbing, or some sort of accident. So, I think there's a lot of different ways and a lot of different roles, but it's, kind of how do we all work together on this issue?
So you just took. Thank you. No, that's fine.
Yeah, I like you.
That's it. So you just took us, though, Derek, in a direction that we were going to go to later. So I'm gonna pause here for a moment and sort of tell the audience that the reason that we picked this topic actually today is that June is Gun Violence Awareness Month. So if you didn't know that, that's actually why we decided back in December that this is what we were doing tonight. So let's talk about guns for a moment. And we had about 10 questions submitted online from folks either who were here or said they were going to be here. Literally 8 of those questions are related to gun control, either for or against gun control laws, et cetera, et cetera. So it's gun control obviously is a very political issue. It's not an issue I think that is going to be addressed anytime soon in the Kentucky legislature. No insults to our senator and congresswoman and representatives in the House that are here tonight. But I don't think it's going somewhere soon. So Derek, if you don't mind taking a minute, and from the Whitney Strong side,
Yes.
there's a kind of a unique perspective, I think, on how to deal with this issue. And so there's been in a perfect world, maybe this happens, but in the real world, this is what we can do. So can you talk a little bit about what Whitney Strong does, how they approach
Absolutely.
those issues?
Our approach is using data-driven solutions in regards to responsible firearm ownership. Now, for a lot of people that hear firearms and ownership and responsible, that is a bridge too far, and that is absolutely fine. However, this is what I do know. This administration is Democratic in the city. That is also ruled when it comes to firearm legislation by a state that has a Democratic governor and a Republican supermajorities. We also do a lot of legislative work in Ohio that is completely Republican. We work in Cincinnati. That is there literally isn't even a Republican on city council. Then we do our work on federal legislation. We have a Republican House and we have a Democratic Senate and a Democratic president. That's today. Most legislation, and I'm so glad we have members of the legislature here, takes years to pass. And it isn't just gun violence legislation. It is, hey, David, you want to talk about Medicaid reimbursement rates?
I can talk about that for a while. That's a whole other
Yeah,
community
exactly.
chat.
But the point is it is very slow process. And for us, that's why we do our education programming, because that is immediate. That is immediate intervention. Now, policy takes a long time. So what we do is we say, okay, given this wide swath of opinion, and it is a very wide swath of opinion, where can we find common ground that both sides can agree on, and both Republicans and Democrats, 70% or more, can do, that has the largest impact? And for us, that is CAR, or the Crisis Aversion and Rights Retention. And we have a Democratic sponsor. We have a Republican sponsor on this bill. Basically, at its what it will do is, and we estimate it will be between 400 to 500 people per year. You would be able to, a loved one would be able to go to the police and the judicial system to temporarily remove firearms from their home. People that are experiencing a crisis. Now, there's 2 parts of that. One, this could be a very minor inconvenience for somebody, and they always have the idea is these person will get their firearms back eventually. But more importantly, what it does is it allows an intervention, right? How do we cool people off in moments of crisis? And that we know we have overwhelming support, but this is where it becomes very hard. There's federal, not only federal legislation, but there are also judicial rulings that have very that will not simply allow what a lot of people would like public policy to do.
So as a response to that, in a practical way, talk a little bit about what Whitney Strong does in terms of its educational component for the community. When you know that legislation isn't going to change tomorrow, but there's things for the community that we can do now.
Yeah, so we have, it's all under our umbrella of our Save a Life programming. The first is Stop the Bleed. So you can bleed out in less than 5 minutes from just a single gunshot wound. So the ability to either pack a wound or apply a tourniquet is absolutely vital, as well as what are the steps to doing interventions to give people the best chance. My boss, Whitney, was shot 12 times in a mass shooting and survived. One of the only reasons she survived was somebody was able to get a tourniquet onto her in 5 minutes. That is a huge piece, and that what we do know is we distribute about 500 of these kits a year, and we know that they are used. Now, we don't get official reports back, but we do know that they're used. There was a great story a couple of months ago of a Central High School student, I believe she was a senior, that there was a shooting outside of Central High School, and she was able to apply a tourniquet and was able to save a person's life. What we do know, one of the reasons the homicide rate has been falling so dramatically over the last 20 years, and even though it's ticking up right now, overall it's down, especially in consideration to how many shootings there are. There's been a lot that has kind of come back, but where you are shot in your body and your access to a level 1 trauma center those are the two actually determining factors of the homicide rate. It is not actually the shooting rate. The other piece that we do is suicide prevention. In the state, 63% of firearm deaths are suicides. In Louisville, that number is inverted. It is 32% of firearm deaths in Louisville are suicide, while the other 62% is homicide. So that is an incredibly important place. And then the last one is safe firearm handling and storage. 80% of firearm suicides for those 18 and younger would go away tomorrow. They would be gone tomorrow if people simply safely stored their firearms. And not only that, if you care about crime, you need to safely store firearms as well. That is the majority and the rises fasting way firearms are used in criminal activities. They're actually stolen guns.
Thank you. So we were talking earlier about prevention. Let's talk about intervention, particularly with community violence. And so we mentioned earlier that there are violence interrupters who actually go into the street and try and keep gangs from retaliating. The mayor's office, Deputy Mayor James, is involved in this, as are the county attorney's office, particularly in the juvenile division, where they actually meet with victims of shootings, sometimes even in a hospital, and have conversations about that. For the panelists, are you aware of any other, and there's more that I'll talk about in a minute if you're not, but are there other strategies within juvenile justice in particular, because we seem to be mostly focusing on youth, that address some of these concerns and help prevent future problems from occurring? It's sort of anybody want it? So I'll go. If you're not going to go, I'll go. So I'll point out a couple of things that nobody here is from. I don't think anybody's here from the Jefferson County Juvenile Court or from the Public Defender's Office or from the County Attorney's Office. But I will point out that that the current administration in juvenile court has been very active in developing a list of providers within our community that are able to provide primary intervention and also support intervention for youth that are getting into trouble. There's also at the DJJ level, there's a program called Juvenile Alternatives to Detention Intervention Initiative, rather. Detentions it's JDAI. I can never remember the right. Juvenile Detentions Alternative Initiative. Thank you. That's what it is. Which, even though we hear a lot about youth in detention, which is actually working harder to provide and support social services agencies and youth serving agencies that can provide a safe place for youth to be rather than in the detention center. And I will just share with you all why this matters. There's some research that's fairly new. I think there was an article about a year ago that one night in a juvenile detention center increases the likelihood that that youth will be shot at a later date, having absolutely nothing to do with the reason they were in detention to begin with. So it's not that they were in detention for a shooting and then were retaliated against, but being in a detention center one night increases the likelihood that that youth will be shot. So again, that's an example. There's other organizations that do some more intervention strategies. I'll move on to some other questions. If you were to create a post-intervention effort, what would that look like? So if you have a youth who has had been engaged in violent acts, what if you could create whatever you wanted, what would you create? What would it look like? I didn't prepare any of you for that question. Sorry. This is the problem with doing a community chat with me, is that I sometimes ask questions that are not on their list ahead of time.
So I think I'm certainly biased professionally, but and also by experience professionally, but I think accessible mental health care, not just for the youth that's engaged in that activity or behavior, but their family and their community at large, is really important. I think one of the things that we're lacking community-wide is the ability to effectively grieve and heal as a community when violence happens in our community, which speaks to some of the desensitization I think you were talking about earlier. So, and that's also where we get the evolution of multi-generational systemic trauma. It continues and it continues and it continues. So we don't have early mental health intervention. We don't support strongly mental health across communities. So we often have youth that think they're being punished by experiencing mental health help instead of seeing that as an opportunity to heal or find a connection in the community to someone else that will walk alongside of them through that journey and walk alongside of their family to attempt to heal and change things. So I think for me, that's a big component. But also outside of just mental health, it is that ability to have resources to heal in your community at large. We cannot do it in an isolated sense. So if you have a child that has felt alienated by their family, by their circumstances, by poverty, again, it comes back to equity at all times, I agree, where if we are not presenting youth with those resources and their families with those resources, wrapping that family in what they need to move forward as a family, we're doing them a disservice. So ideally, for me, it would be all about not just the youth, but the youth and their family together.
So I don't want to give up my clinical psychology license, and I don't want to give up my history of doing work in the trauma sphere. However, I'm going to ask this, Trent, I'm going to ask you to chime in here, because we were talking before about the intersectionality of poverty, economic opportunities, poor education. I mean, these are youth who are 3, 4, 5 years behind, maybe sometimes more. I consulted on a kid today who's 18, whose reading level is in the first grade in juvenile court. If it can't only be about therapy. We put therapists into the family courts, into the juvenile court setting 15, 18 years ago. So what more do we need to do? There's more that we need to do.
Sure. So in terms of intervention, we talked about a lot of root causes to violence, but I think that violence happening also becomes a cause itself, kind of again in a cycle. And I think that there should be a two-pronged approach to the problem as a whole, and that is certainly like robust programming that engages and empowers those who are affected. And then the other way is definitely policy that addresses systemic issues. And so we got to understand that first, we got to know what the root causes are of the community violence that we see. Then we'll know what policy to support. But I think that we need to have a heavy focus on policy that addresses systemic issues, because that's what causes the violence in the first place. We'll just be spinning our wheels forever if we're just thinking about intervention after violence happens. So I just say that we got to know that there is policy that does that. And it's not going to be called, oh, this is a violence prevention bill. Oh, violence prevention bill, violence prevention. No, they're called different things, but it has to do with causes of violence, which is access to quality education, which are things that address poverty, et cetera. So, yeah.
Thank you. Quante, do you have any thoughts?
out of experience of being shot, I would say therapist is like the biggest part, and not only in the courts. I would like to say I would like to see therapists in the hospitals, not just in the trauma room, but in the waiting room. Because see, this is the thing. When you see somebody get shot or one of your loved ones get shot, you get shot too. Because see, you have to go in there and you have to look at them when they tubed up. You see what I'm saying? Or when you're going through the experience, it's you that's on that pain medicine. It's you that's being stuck with a happy. And kids, the youth is not like, okay, for example, with the stuff that just happened over the weekend, a lot of those kids is affected by that, but they don't have nobody to talk to. And then with them not having nobody to talk to, can also grow a thought that they think that this is a way to protect themselves, or they think this is a way to survive, and that's wrong. So I would say like therapists, because everybody needs somebody to talk to, and really, it's really a mental health thing with the youth, because they not just waking up like, oh, I'm about to go hurt somebody, or I'm about to do this, I'm about to do it. No, that's not in the case in nobody, and none of the youth. The cases, the resources. This child might feel the lights is about to get turned off, so they go outside and they do what they feel is necessary to. You see what I'm saying? And that's wrong. If they had the correct resource or somebody to talk to tell them like, hey, I can help you. You 13 years old, you 14 years old, you shouldn't be worried about this. And that goes hand in hand with it helping the family out, because that child is also letting you know that, hey, my parents need help, or whoever's taking care of me need help. We need help. So that's all I got to say. I thank the therapist.
So your comment chimed in perfectly with a question we received online about 5-10 minutes ago, which is that for the panelists who work directly, for those who work directly with those most affected in the neighborhoods by gun violence, what do you say to someone who says, quote, I can't give up my gun. In this neighborhood, you would be stupid to not carry a gun for protection, end quote.
If we being honest, me personally, I wouldn't be able to tell them what not to do, because that's another problem. You can't tell someone how to go about a situation when, one, you never been through it, or two, you never experienced it, or three, you're not brought up in that community. And that's a big problem. That's why we heard, because of that reason. It's a lot of the youth that thinks that they can't go outside without their gun. Why? Because it's other kids that has nothing to do. And it's problems that's caused at home that's fueling this motivation to this thought that leads up to this action that causes this problem. That's why we're here. So what I would tell that person, man, get out of that community. But who am I to tell them that when they can't get out of that community?
Right.
They don't have the proper resources to get out of that community, or the proper help. Or if I was to tell them to go talk to somebody, who can they talk to? Where can they go? There's no buildings or no spot where I can be like, I can shoot to a therapist up the street real quick.
So that goes back to investing in the communities with other resources, so that there's
you have to
supports.
invest in the community if you want to see a positive change, because right now it's negative, and you're not going to get nothing but a negative outcome. So if you want a positive change, you have to. It's just like anything else. Just like you invest time into your child, you should be able to invest time into any child, into every child, because any other child is around your child, and it's all influenced
Right. So
it be all an influence trend. That's what the youth follows, a trend. So
Right.
if it's a positive trend going on, then you get a positive outcome. If it's a negative trend going on, then you get a negative outcome.
okay, thank you, Quante. Derek, you look like you were going to say something. I'm
Yeah,
gonna come back to that.
we are actually developing a training specifically designed for Black youth around firearm safety and handling. We don't care why people have guns in their home. We don't care how they get them. We know the consequences. We just had a 2-year-old shoot themselves in Portland. The fastest rising group right now for suicide is young Black males, followed closely behind by young Black women. So it's a question of how do we find them and meet them where they're at, right? And so, but I completely agree. There's a larger piece that needs to be addressed of why do they feel that they need to have them, right? But right now, if they have them, what are ways that we can work with them to lessen the impact for the possibility of using that for violence?
Okay, thank you. So as we were talking about investing in the community, we had it tied in earlier with a question on online and another question that's going to come up here in a second, which is the online question was, what can regular everyday people do to help the community centers get back up and running? There are so many people who are ready to engage, but do they have a way to contribute?
So I want to actually take a step back. I'll address that question as well. But the last question as to what to say to someone, that's carrying a gun, that lives in a neighborhood, blah, blah, blah. I agree with this brother and everything that he said. And then notice where he stopped was from his perspective, what he knows, as in I can't tell them not to carry the gun. I don't know what to do. So I want to pick up where he left off because that's what it takes is a community approach. So I would agree with him on that. I'm not going to tell someone living in a neighborhood that's dangerous what to do, but I will point them in the direction of a solution. And so from my perspective, and this kind of goes with the
Yeah,
next
it's coming
question,
there next. Yeah, that's why I went that direction. Thank you, Trent.
which is that you have to support some of those multifaceted solutions. Our Metro United Way, we definitely advocate for policy and robust programming. One of the programs that I oversee is called the Black Love Philanthropic Partnership. And that love is a word it's an acronym, that stands for Live, Own, Vote, Excel. And so we empower Black nonprofits in a cohort model. And so I would turn them to an organization like Joshua Community Connectors or Brainstem, which is a youth educational program. Or Play Cousins Collective, or any of these wonderful Black-led nonprofits who we should be centering. So as to your question, I would say how to support community centers. There are ways, and there are ways to support community programs, but you have to seek those out. And I won't ramble, but go to Metro United Way's website. We have more programs than even what I'm mentioning right now, but I think it's about engaging the people who are affected to find the effective solutions.
And I think my comment on that is donate what you've got. So donate your time, donate your money, donate your resources. They're necessary, they're needed. You are needed. It is a community problem. And we can't say, hey, it's a lack of resource in West Louisville, and because I don't live there, it's not my problem, and it's not my place to spend my time. It is your place to spend your time. It is your place to spend your money because your kids are our kids, are everybody's kids, are everybody's brothers and sisters, are everybody's parents. So yes, go to Metro United Way. Yes, look up places that you can donate your time and energy to because it doesn't have to be about money, although money is great, right? Expose your kids, expose your family because we're all in it together.
Thank you. So a question for all of you as well is, yes. So can we, so we're going to save time for questions for sure, but if you have a question that you want to ask right this moment that has to be asked right this moment, you ask it. Okay, that's all right. That's why we're here. All right. How do cuts in the city? So we've been talking about. I want to get back to sort of some of the solutions. So how do cuts in the city funding potentially affect programming in violence reduction?
Yeah, one more time.
Well, how do cuts in city funding, and I'm not sure where this question came from, to be honest with you, but how do cuts in city funding potentially affect programming in violence reduction?
Did you just ask me how does the funding affect?
Yeah, how does so the city there's a new budget out, and again, you may or may not be aware of it, but how do those what impact does that have? What are we looking at this point?
We've talked about root causes. I just say that, and I'm not going to go into detail about the city's budget, but I just think that the budget needs to reflect where our values are and how we want to go about preventing violence. So that's, of course, a further conversation, but I just think in terms of the budget and the funding, there has to be priority there, and it has to be according to a community approach to preventing violence. And again, there has to be an equity focus there. So I think that the people who are most affected, their needs and leadership need to be centered.
And I don't know if I'm speaking out of turn, I'm hoping somebody in the audience, 3 rows from the back at the end, will stop me wearing a black shirt. So one of the real issues that is occurring in our community, and this was actually a report from a couple of years back, is that some of the funding that has infused into our community so far is related to funding from the pandemic, American Rescue Plan Act funding. That funding is sunsetting, and so one of the efforts that the Office of Safe and Healthy Neighborhoods has done, because their budget has expanded pretty dramatically over the last 5 years or so. And so they've been able to fund some of these community interventions. And whether you agree with this approach or not, I think my understanding is that one of the attempts that they've made, and this comes from a presentation for the Bingham Fellows, is that Ocean has purposely hired data analysts so that they can do make an informed effort to analyze the impact of the funding efforts that they've made so that they continue to fund programs because they're not going to be able to fund everybody at the level they're funding now because we're losing some of the money that's coming to this community. So the way to make those difficult decisions is based on impact, not based on who you know. So before I open it up to you first and then other questions in the community from the community, there's a question here from a QR code that we haven't addressed, and it's completely different than anything I've asked, and I'm a little embarrassed given that this covers about 20% of the folks we serve. And as I ask this question, I'm also reminded that I didn't mention why you hear an echo in the back, and that's because for the first time, thank you to Jose Doniz, who's helping us so that we can translate our community chat in Spanish for our audience. And so the question, and now you'll know why that occurred to me as I said this, the question is, how would you bridge the gap for the international communities in regards to violence?
I think that in terms of effectiveness, when wanting to prevent violence or even just that whole conversation, I think that cultural competence is very, very important. Just various services to have that address the people specifically who you are dealing with. I just think that certainly needs to be a priority. So there needs to be a bridge there, and it needs to be effective. I think data-driven approaches are always good. I don't have a silver bullet on how to do that, but I just want to say that does need to be a priority.
Any other thoughts or reflections? Okay. Thank you. So I'm going to add, before I ask you all to leave, I'm going to ask Helene Traeger-Cussman to come up. Helene is a member of our board and was our board supporter for tonight. And she'll have some closing words for all of us. And I will say now, thank you all for coming. And Helene, thank you.
Thank you. So when I first talked to Courtney about this event, or when I first heard that this was the community chat, I knew that I wanted to get involved, because I think that, like many of you here, whether you're here to find out how to get more involved or educate people on how to get more involved, it's so important for us to come into one room, into one space, and have these discussions that aren't always easy to have, and to have them locally too, with people who, we can see our neighbors, we can see people who we might not always see, people who we do always see, and come together and just have these important conversations. And we've heard tonight so many different ways to get involved. Something that I just want to repeat again that really stuck with me was when Dequantay said, just like you invest in your child, you invest in any and every child. And as a mom of two, that was part of my motivation too, of why this is something that I feel passionately about. I want to get more involved in. I want to educate myself more about, because we all need to look and see all of the children in our community as our own. And until we get to that point, like was mentioned so many times tonight, that's really the key to overcoming this issue. I'm on the board of directors here at JFCS. And as David mentioned earlier, we are an organization that is rooted in Jewish values, and we serve the entire community, regardless of faith and background. So you heard from him some of our services that are really relevant and programs to what we have talked about tonight. We have so many different services, from our food pantry to counseling services. So glad that everyone's here. And you do have a QR code that you can scan on the sheet for tonight if you'd like to get more involved, if you're not already involved. But just want to say thank you so much to our sponsors, to our panelists for taking your time, your resources to be here. Thank you to everyone who asked questions tonight. I know it's not always easy to get up and talk in front of a room and share your knowledge and your questions. So thank you for being here and being part of our JFCS community.